Okay, everyone. Thank you for coming to our live. We're going to start again. We were just trying to get Dr. Julia sent on, and today we're talking about parenting after surrogacy, which is something which is near to my heart. I support a lot of intended parents, or my main role at the Canadian Surrogacy community is to support intended parents through their journey, and that's really coming full circle for some individuals where they're already at the end of their journey. And they're asking questions like, how do I navigate my new relationship now with my surrogate? How do I do this after I've identified myself as an intended parent for so long? I'm just going to invite Dr. Julia some of these questions. And really, it's about really at the end of your journey. It's if you've identified yourself so long as an intended parent, all of a sudden you're meeting your surrogate as no longer an intended. You're shedding that intended parent part away, and you are now a parent. And so there's this role reversal. There's this switch that happens in between yourself and your surrogate. And so there's like relationships change, you change. And also, if you've dealt with a lot of trauma with before your surrogacy journey and you've had infertility, that is one trauma that went into another. I mean, we say surrogacy is definitely a roller coaster of emotions, and it is absolutely true. So let's see if we can get Dr. Julia Sun onto this live. If not, we're going to try something different. Is she even on? How to join our live. One of the reasons I invited her was because I've had some conversations with intended parents of like the navigating of surrogacy navigating being a parent post surrogacy, and the more trauma you've had before the end of your surrogacy, the harder it'll be to just be able to let go of and just be, because now all of a sudden society expects us to be joyful, abundant, grateful, and when we admit that parenting is actually hard, then you're opening yourself up to the possibility. Yes. Oh, there you are.
Okay.
Oh my God, yes.
Excellent. Good. I'll try to get you on this here so that I don't have to hold it the whole time.
I mean, I was just finishing up saying that if you haven't dealt with a lot of the trauma before or during surrogacy, essentially, you know, and then society wants us to, as intended parents, to now be joyful, to now be grateful, to now be thankful. And then there isn't any room for us to, and then we're also told that, you know, you now need to engage with your child all this time. And there's an additional layer of guilt of letting your child have independent play because we worked so hard for this child, then we should be fully engaged. And that's when burnout starts. That's where parenting is hard. That's where declaring to individuals who know that you've had your child via surrogacy is also hard because you're opening yourself to criticism. Well, this is what you wanted. You wanted this, and everybody told you how hard it was going to be. So why are you complaining now? So there's this additional layer that individuals with infertility, and then on top of that, surrogacy. But not only that, I think that our hetero couple, that our same-sex couples face similar challenges, but on a completely different level. Society, two daddies, how do they work for that? Anyway, talking all about that, let's introduce Dr. Julia Sen after we've had all of the issues with technology.
The phone is the way to go. I'll know that.
Who are you? I'm going to put myself on a timer here so like we don't go over. And first of all, say, shh. There's my dog. Shh. I'm sitting outside. Tell us who you are. Who are you? Like a quick bio about you, and why should we listen to you?
Sure, absolutely. So, hi, thanks for having me. I am Dr. Julia Sen. Of course, call me Julia, and I am a psychologist in Ontario, a clinical and counseling psychologist. And I've been working. The reason you should, I guess, listen to me, or at least, you know, sit with me here as we talk about the journey through fertility and parenting, is because I've been actually doing this for 14 years just in the fertility world, and I've been seeing clients, of course, for over 20 years. So I have a lot of experience with fertility and in parenting as well, and then, of course, specifically parenting after infertility. So, yeah, I do the whole journey.
The whole journey. So in your practice, tell me, what have you observed about parents post-infertility and post-surrogacy?
Totally, yeah. There's definitely a theme, and you were mentioning some of them already as I was kind of joining, but really, you know, this pressure to feel like you need to be happy now all the time, and that this is the miracle you wanted, and so now you better not have a moment of not appreciating it, right? There's a lot of pressure, and of course that's not sustainable. It's not realistic at all. So we need to really look at having compassion for ourselves and recognize that we've been through a lot, and just because we have the miracle baby now doesn't mean every moment is going to be blissful. That's just not realistic. So that's one huge pressure that people feel, you know, that idea that I have to be happy all the time, and then guilt when you don't. The other is hypervigilance, right? Through fertility, yeah, there's so much loss and unknown that they were wired to become vigilant, right? What could go wrong? What could happen? Mm-hmm. And so then we're sort of in that state still, even though the baby's here now, or even when we're pregnant, or, you know, or expecting through surrogacy, however that looks, there's a vigilance, right? We're waiting for the shoe to drop. Mm-hmm. And that, of course, is creating chaos within us, and in terms of parenting, will also not allow us to stay present with our child as much because we're always looking at what could go wrong, right?
So we're still in that like almost like a fight or flight kind of state at even post.
Totally. Wow. Totally, yeah. And it makes sense, right? We've been wired for so long, depending on the journey, whether it was, you know, a year or 5 years, right? You know, that we've been wired to feel this, you know, it's such a difficult and traumatic process to go through fertility. And so it's not going to just go away just because a baby has arrived.
Absolutely.
Right? Or just
my experience myself as an intended parent is that everybody kind of waits. There's that 25-week mark for baby viability. right? So if a baby's born after the 25 weeks, you know, okay, we can put them in NICU and sustain them in some kind of life form, but anything before 25 weeks, everybody's like, like still in that trauma state, and every single week is getting to that 25-week mark. And once you get to that 25-week mark, I've observed that intended parents literally like are like, okay, now we can go to Toys R Us. Now we can really celebrate this thing, because even though this baby is like healthy, viable, pregnancy is going, there's still that, as you were talking about, that vigilance of like something could go wrong.
Totally.
Right? Yeah.
Totally.
So that would happen in with, I mean, that would happen with infertility at the same time. So what do you wish you could tell IPs or intended parents about the transition from surrogacy? Specifically, we're talking about surrogacy, assuming that we've also had, and also keeping our same-sex couples in the forefront, because even though they didn't go through infertility, they are still, you know, they've had to make a lot of room for potential criticism of their choices, realizing that maybe at some point in their life they realized, they came out and they realized that maybe my family isn't going to look this way. So they have a different kind of trauma walking into this. So what is it that you would like to tell them about and help them with the transition from the surrogate journey into now babies here and parenthood?
Totally. Yeah. The most important thing, I got to honestly, is to learn self-compassion and learn it, right? Not just be self-compassionate. That doesn't mean a lot to people. You know, I'm supposed to be nice to myself. That's not helpful. Like, it's a skill to be learned. Right? Compassion, empathy, these are skills to be learned. And so Dr. Tara Brach is a specialist on self-compassion. And she has many, many resources on her website to, you know, help you learn how to become more self-compassionate. So that's one, just the most important thing for all of the areas. Like, it doesn't matter whether you're, you know, transitioning from surrogacy or however you are on this journey, but self-compassion is critical. And I really want you to recognize that others don't know what you've really been through. And so when they make their comments, or their judgments, or, you know, like what you were saying just a few minutes ago, like, just, we want to be able to recognize that they don't get it, and they're going to make the comment. And when they make the comment, yes, there's going to be this pang or this yuck factor, I call it, you know, that will come. And then we want to be able to soothe and comfort ourselves. That's something I'm very focused on in training, and all the programs I offer and everything else is learning how to soothe and comfort, because that's the key to being able to then move forward again.
Right.
Yeah.
And so that goes into my other question of is, if we don't soothe and comfort, if we don't learn these skills, then how will that affect your parenting? Like, what would happen to your relationship with your child and your environment? What's like the,
if we don't really like the consequence sort of thing, right?
Happen?
For sure. So what we have to look at it, okay, we don't want to say that if you don't do this, that your relationship will not be good. Of course, that's not a truth either. But we want to be able to sort of help the relationship along, help the process along. And in order to learn those skills, by learning those skills, I should say, what we're doing is being able to stay more present with our child, right? Stay more connected to our child when it makes sense to be connected to our child. And it allows us to then also have a really calm energy. And our children, they resonate to our energy. As parents, we have power, whether we like it or not. You know, the power is there. And so if our energy is antsy, say I'm still in that hypervigilant state, right? Or another common one with the fertility journey is what's next, right?
What's next? Yes.
Right. So that didn't work. What's next? Or what's the next week? Or what's the, you know, that kind of. So that also isn't helpful in parenting, because then we're not with the child. We're just thinking about what's next. And then again, the child loses our presence, and that's what children need, is our presence.
Right.
So yeah, it allows that. Yeah.
And A lot of parents come up to us and ask us, now that they've had this intense relationship with their surrogate, right? You know, and their families have been part of a different family. And I really find that the intended parent journey isn't really, it is about the baby, but it's about supporting the adults in the room and the relationship. So how do you, now that the baby is in the intended parent's hands and they're no longer really supporting the adults in the room and the relationships in the room, and now they're focusing and now going to the baby, how do you create a natural and healthy boundary with your surrogate? Like, what kind of conversation would you have? What are you looking for? Like, I don't even know how to phrase this question, but do you know where I'm going with this? I think the question asked is by intended parents, like, how do I create this now healthy boundary with my surrogate that I message and texted like and talk to all the time? Yeah. How is it okay for me to retreat? Like, how do I even do this?
Yeah. Part of the answer to that will be when you began the journey with them, there may have been some like discussion about that. And hopefully there was some, like, what will it look like once the baby's here, right? So ideally we would kind of go back and remind ourselves of what we discussed at the beginning. If nothing was discussed, then it needs to be discussed now, right? What feels okay for us? What feels like a gentle but still clear transition? Because it's also hard for the surrogate or the gestational carrier, right, to just be cut off, right? Unless that was decided ahead of time.
Well, no, we're really cut off, but it's more so like, you know, that you're not checking in as often. You're not doing that as often. You're not like, how are you feeling? Like, do you need any food? Like, you know, like there's that checking in, and then there's the other way. So there's just this weird space of like navigating this. Okay, we're now both parents. How do we do this? Right?
Totally. Really openly. I mean, you've had a relationship with this surrogate for the last 9 months, and so you want to be able to really sit down and have an intentional discussion about what would feel okay. That's the key. Versus, okay, we're just pretending, or we kind of guessing what the other one thinks or no. Like, we don't want to do that. That it's not respectful to anybody, and so we want to really say, hey, could we sit down? Even just for an hour, right? And let's really just talk about this now that baby's here, and how do we want it to look? What would feel okay for both sides?
Right.
And open that up to, and be honest, right? And see where we can come to a place of understanding and respecting each other's needs.
Right. So basically just continue on with as you were, with being open and honest with what you need, even though sometimes at the beginning of the journey we envision this kumbaya, all of us sitting in the woods in the cabin or whatever and looking over our like creation that we've created, and then during the journey it may turn different, and because what you discuss may actually be a different scenario. So re-establishing, I guess, expectations is what you're talking about,
right?
More so, right?
Exactly.
Right.
So we're all on the same page. Yeah.
Right. What should, I was going to ask you. So one thing you mentioned to me at one point is that parents who had faced infertility and surrogacy are more likely to face postpartum. So what should a parent in a hetero and also in a same-sex couple be looking out for each other, recognizing to maybe recognize some of those postpartum things? Because as we just talked about, it might be harder for us to even admit that we're struggling, right? Because we're supposed to be joyful. So do you have any comment about that, like about postpartum in the fourth trimester for individuals who had faced infertility, or even a same-sex couple, or post surrogacy?
Yeah, it's a great question. It's such an important one. So thank you for bringing that up, because of the pressure of the joyful, I'm supposed to be joyful, people don't share it, right? So they hide and they sort of endure the feelings when they don't need to, right? These are normal experiences that we just want to be able to identify and then seek support for if we need it, right? So the first sign, I mean, it could show up in anxious ways, or it could show up more sad, depressed, right? Manifestations. So it's not like, oh, I'm anxious and that's not it, right? People always hear postpartum depression, but it's really more than just depression. You know, there could be an anxiety presentation. That's one thing. So I'm extra anxious, right? You know, like I said, the vigilance piece is going to be there, and we have to learn to soothe and calm and become more directed to the now. But there could be an added level where it just doesn't stop, right? The anxiety is constant,
right? So we're like constantly worried. We're constantly on edge. We're constantly, because if you tell me like I have an anxiety around it, I really don't know what I'm looking for. What is that? What's the difference between normal worry and constant worry?
Yeah, the amount of time you spend doing it, really, is it taking up a lot of your day, right? Is it interfering with life as a parent or as a person in general, right? That's going to be where it's like, okay, yeah, it's a lot of my time is being spent sitting in anxiety, sitting with panicky feelings in my chest, or feeling sick to my stomach, because it could be a physical manifestation as well.
Oh, so like,
right? It doesn't always
well, but it's actually,
yeah,
could it be like a physical manifestation of like going to the washroom too often? Like it could be like all of that because you're holding everything in. So these are like little signs that something's, maybe I should just pause and look.
Yeah,
that's very good. That's very.
The first month that would be very, very easy on yourself, unless it's extreme, right? You know, but after a while, if you still feel like this is happening, it's worth you know, looking into, just checking in with your family doctor first, and then you could seek out support systems as well, like psychologists or other counselors, of course. And in terms of the depression piece, yeah, you know, deep sadness and a sense of not really seeing the point, right, of being here, feeling high levels of guilt, right, that I don't like my baby, you know, these sorts of things, which are, again, they can be very, very normal, very common. So we don't want to judge ourselves. We really want to bring compassion. And then if it's coming up, it's just, yeah, let's just talk about it. Let's seek supports, you know, right. Because it's, you know, it does take a village.
100% village took a village to come to this point. And we can't expect to all of a sudden not have the village to lean on in terms of resources, which is one of the reasons I constantly introducing you as one of the resources in our community for intended parents to reach out to you. I'm going to ask you this question because it's, I think it's something, it's an expectation, maybe societal expectation overall, you know, after all this time I've had my baby. Is it normal for me to not love my baby as soon as I see my baby? I might have experienced like feelings of like euphoria of like it's here, but is it normal for me not to bond or feel bonded with my baby right away? Is that a normal feeling, Dr. Sun?
Yeah. So Julia, for sure.
Julia.
But, yeah. So the word normal is very, very tricky. So I will say it can be a common experience. And so again, looking at, is this like 3 months in? How far are we along here that we're still not feeling connected? What is happening within me? Because a lot of times, like I said, we're holding on to a lot of grief. And that's just sitting in us, right? Grief is a valid experience through everything we've been through when we've gone through the fertility journey, right? So it's really important. We tend to ignore that. Now, when I work with my fertility clients and then they become pregnant and we work through that, we specifically take time to allow ourselves to grieve all the losses, you know, then it lifts a little bit, right? That's why it's important to do that. But if we're feeling a disconnect, it could also be related to grief. So just to look at that, have I processed my grief?
Have I processed my grief? Got it.
Because just because the baby's here doesn't mean my grief's going to go away.
Right. So it just essentially, it's, so I don't want to use the word normal, but I'm going to use lay terms for individuals. But just like if you're not feeling automatically like bonded or connected, or like those, as people have described it, you see your baby and all of a sudden this, I've fallen in love again or something. It's okay for you to do that. Just really checking in of what else is there for you to process is what you're saying, right? Like there could be
Yeah.
something you're missing, missing a piece. It doesn't mean there's you're, there's that guilt, right? Why don't I love my baby? Why do I feel bonded with my baby, right?
Yeah.
I should be bonding with my baby. I should be bonded with my baby. It's my baby, right? What's going on,
Yeah.
right?
And that's, again, that huge pressure. So bring compassion that you've been through a lot. If you've been on the fertility journey, you've been through a lot.
Mm-hmm.
And we really need to recognize that. We kind of forget when we're in the trenches of what we're going through. When you take a little bit of a bird's eye view and realize, wow, look at this journey that we went on. And yes, great, this is fantastic. We have the baby. And I'm still a human. And I went through a lot to get here. So I'm not going to just flick a switch and suddenly be on and everything is going to be great.
Right, because one day here, one day baby isn't here, and one day baby is. Right? It's
That's
like
it.
that's it. That happens, and but you're still the same person you were yesterday, except now you're holding a human.
Exactly.
Right?
Exactly.
Not all those things will necessarily be processed. Is there anything else you'd like to add, that you'd like to share, that you would like to really share with your audience before I ask you to tell us a bit about your programs and an invitation to how to reach out to you, how to access you, and in a way? Is there anything you'd like to add or comment that I may have missed?
Yeah, there's one thing, and that is that I want everybody to recognize that you can have moments of joy and moments of sadness and moments of worry and like that's the human experience, right?
Mm-hmm.
And that's okay, right? Allow yourself, you can feel gratitude for having this baby finally and feel grief at the same time, right?
You can feel those two things simultaneously.
That's right. Yeah. And so it's really, again, I really just want to emphasize taking off this pressure that I have to be grateful, ecstatic, connected all the time. You're still a human being, and you're a human being who's been through a very difficult journey. So we really need to bring that compassion in. And again, soothing, learning, breathing. I think we talked about making sure we give them some techniques here before we,
That's a technique. I wanted to make sure that we have something practical that we can practice if we're feeling this way. What I think you have a few. I think you've taught me.
The most important one is the breath, which you'll hear in everywhere. So, but it's true. So, and the easiest breath that I would recommend right now is either a 5-second inhale, 5-second exhale, or a 4-second inhale, 6-second exhale. Okay. And in through the nose always. You can go out through the mouth if you need to, but then I was told, yes, do it like a straw, right? And then if you can blow out through the nose, that would be great. But if you can, that's okay. So, but in through the nose. And then 4 seconds in, 6 seconds out. Let's just go with that one. Repeat it 4 to 5 times. It just starts to regulate the system, and that's a very important piece. So when you're feeling overwhelmed, when you're feeling disconnected, it even brings us back to feeling more connected. That's one huge strategy to just practice, not only when you're feeling something, but just because. So wake up in the morning and do that. Go to bed and do that.
Right.
As you're going to bed, do that. And then you can also do it, obviously, reactively.
Right. And this is also a good thing for, when you're tired. And I found that when I had our baby, like my weakest part of my 24-hour cycle day was 4 o'clock in the morning. And I was not, I would say to you, my brain was not functioning. I think you would say at an executive level. I was not processing. I was like I just was so vulnerable at that point. So my reactions and my emotions were like upset, anger, or whatever. Why are you crying? Like that is like, I think, a moment where I don't have didn't have control over my emotions. And I realized, and I had to be like, okay, I can't do this. I need help, right? I need you to step in, or ask your partner to step in. Like, just recognize this might not be the best time for you. you need help.
That's that compassion piece, right?
Yeah.
That's exactly, and that I'm going to go back to that as another huge skill to learn is self-compassion. Right?
Right.
Compassion for others we tend to have. I'm talking about self-compassion.
Right.
And learning how to be that kind self to yourself. And that's partly that is breathing and doing these techniques, right? But it's really catching your critical mindset, or, you know, the part that really, yeah, that's hard on us. And so shifting more into compassion versus critic, because while the critic has its role, I'm not going to get into all that now, it's not all that helpful, especially after we've been through what we've been through.
Right. So how can our audience access you, your programs? What would you suggest to them first? They finish an surrogacy journey. What should they look for when they enter your website? Like, first of all, highly recommend signing up for Julia's amazing emails that I get almost weekly, I think, or every so often you send. They're amazing. They're absolutely amazing. I read every minute. I read every word. They're just every single. It's like an hour of therapy in your email. It's fantastic. Love it. So I really would love for everybody just to do that. And then tell us a bit overall about your programs, but like the next action someone could take post a surrogacy journey that they could access you.
Totally, yeah. The best thing right now, so I'm creating for parents after infertility a program, or it's like a membership basically, but the idea is to help you shift away from the hypervigilance, the what's next mentality, the loneliness, right? And into a state of calm, presence, confidence actually, and compassion. So it's a journey towards creating a state within us that allows for wonderfully connected parenting the way we want to have, and then I also have if you're expecting, right, so baby hasn't quite come yet, but you're expecting, that's another course that I also offer. So depending on what you're looking for, you can, if you're already a parent and you've been through the fertility process, or you've been an intended parent and used the surrogacy process, then the best place to reach me, just to connect with me so we can talk about what the needs are, is my email, which is belonging@drjuliasen.com.
Okay, I'll put that in the caption below.
Perfect. If you're a parent, just type in parent. If you are expecting, type in expecting. Okay. And I would also love to just call out to the incredible clinics that are out there, fertility clinics, and the amazing doctors who brought you to the place where you can now say that I'm expecting, or that I'm a parent, who helped you get there. I want to just call it to doctors as well, to refer their clients or their patients to receive more support on this journey, right? Once they're done there, it's amazing, and there's still a journey because of the trauma that they've been through. So I'm just inviting, the clinicians as well to join me in this stand, because I think it's an area that isn't talked about enough. And
absolutely.
I really want to change that. Right? I want to change that.
We're calling you
Disney. What's that?
Tripod just joined us. So
that's
our partner. So yes, would love, absolutely. Thank you so much. I'm so glad we were able to connect and to join. I'm going to share this link through our newsletters and other social channels. Please do reach out to Dr. Julia. Worth every moment, time, and investment. I can't say more than enough about you. And I think that's it. And we'll see more of you, hopefully. All right. Thank you.
Thanks so much, Agatha. All right. Take good care, everybody. Bye.